Preview.
Welcome to another segment of Her Health. I am Dr. Maya Green, also known as Dr. Maya 100. And today I have with me another leader in healthcare in her work life, but also here to talk a little bit about her journey through healthcare in her personal life, Dr. Ramona Burress. Welcome.
Thank you, Dr. Maya. So excited for this conversation we're going to have today, this honest dialogue.
Yeah. So we met in our professions, right? You're Dr. Ramona Burress, I'm Dr. Maya Green. And through that time, we've gotten to know each other. We're just Ramona and Maya. You know, I like to call you Moni B sometimes. And one of the things that I think made me realize or helped me to realize how important women are in healthcare. And not only should we talk about healthcare, but we have to come with our full selves, and authenticity is we don't know what someone's going through, right? So a couple of years back, you shared with me that you were diagnosed with breast cancer. And that was a shock to me and everyone, because you walk around and it looks like you have it all together, and you begin to share more and more about how you do what you do and how you kind of walk through it, and how you manage in your daily life. And I think that is something a lot of women out there and men kind of need to hear about. So thank you for being open to kind of talking more about that with me today.
No, and thank you for having me, Maya. I want to say if we met, maybe it was towards the end of 2014. And, I think I want to apologize because I always had that resting BI blank, 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 blank face because I was going through my, breast cancer journey at the time. And I thought I was wearing a facade. I thought I had this veil. But as I look back on my life, I'm like, there were some spaces where that energy, negative energy, kind of maybe infused itself because I never really dealt with it or never really shared or allowed myself to be vulnerable. So I'm gonna apologize to you because it took us a minute to become besties. And I think that was because, I was carrying over some of that anger that, hindered our fruitful friendship that we have today. So, but yeah, let's see, going back to 2013, I was 34 years old, and I felt a lump in my breast. There were a lot of things going on at the time when I found that lump. I had decided to get a divorce and leave my husband, whom I had been with for 17 years. So essentially we grew up together. I really had to come to grips with leaving that idyllic version of the Cosby family that I had, dreamt of since I was a little kid. And really, kind of deciding or understanding what was next after, the dissolution of marriage. So it's interesting enough that I decided to leave him, let's say September of 2013, relocated my family, so myself and my 3 kids. At the time, my oldest daughter was probably 13, and I have a set of twins who were maybe 8 at the time. And, getting them reacclimated to what was life without dad, without this nuclear family. And, in the moving process, I'm sure, we've all moved a million times. I can remember like just doing too much, right? I hired movers, but I was still moving, some stuff. And I can remember we were moving a dresser and I was coming down some stairs. And I remember that dresser kind of hitting me in my chest. And I was like, "Ooh, that hurts," right? And mind you, audience, I never had boobs. I always wanted boobs all my life. So at the time I was probably a negative A cup because I was an A cup before breastfeeding 3 kids, but you know how the body shifts after that, it became negative A. So I had pain from what I thought was that dresser hitting my chest. But as I investigated more, in my investigation, it occurred in a shower, just washing up and cleaning myself. I'm like, what is this lump? And I had had lumps throughout my life in my breast, and they really kind of correlated with my cycle. So I'm like, okay, I'll watch this thing and see. And it just didn't go away. The month of September went past, October went past, November, it started to become a little bit painful. And the lump was located on my left breast, and I'm left-handed. So that pain was showing up in my workspace. It was kind of hindering my performance. As a pharmacist, I was still cutting pills, counting pills and, writing prescriptions out, blah, blah, blah. So I called my doctor And she knew that I was going through this life change of divorce, relocating, getting the kids acclimated. And I had just seen her that July. So, the first conversation was like, Ramona, I saw you. I did your full exam. I don't think it's anything. Let's just wait and see. And then maybe like 2 weeks later, I called her back because that pain was just persistent. And again, I'm left-handed. It's on my left side. And again, negative A breast. So, there was nowhere for this lump to kind of hide in any tissue because there was no tissue. And again, I kind of got dismissed. Like let's just wait and see. Because again, remember, I'm 34, and I didn't have any identifiable risk factors. I didn't have any family history. I wasn't considered obese at the time, but now my BMI says I am obese. I didn't take any hormonal contraceptives. I wasn't drinking, excessively. So all the things that, we kind of categorize as risk factors, I did not check any of those boxes. So it took a third phone call because the pain was getting severe. And again, the lump was still present. And I said, I got to see someone. So I got an appointment. I wasn't able to see my physician. I saw a partner in her practice and, another woman. She's filling me up, kind of manipulating these negative A breasts. And she was like, I don't think it's anything, but because you have Blue Cross, let me send you to get a mammogram. So mic drop, right? So for the audience, I'm a pharmacist. I know how this game goes. Again, most of the clinical guidelines tell us that mammographies are not needed for anyone under the age of 40, especially for someone who was presenting like myself, who didn't have any risk factors and nothing to kind of, clinically justify a mammogram. So the fact that I had this private insurance, I guess kind of opened the door for me to get a mammogram. And, we're getting closer to Christmas by this time. So I went in for that mammogram. I remember I took my mom in with me. At this time, I had not disclosed this, what was going on to my kids. And Dr. Maya, please interrupt me with anything if I'm kind of speeding through this story fast, because it's like, in some spaces, it's PTSD. But, I took my mom with me to be my source of, a shoulder to lean on in this process. And I remember, again, it was like maybe a week before Christmas, right? And this is the first Christmas the kids are without their dad. So I'm like, I'm trying to do it up and be the best mom ever. And in that mammography appointment, I got called back to see the technician. She put me on the plate, and again, negative A cup. So I felt like my whole body was like in the machine trying to, get these boobs flattened. And it wasn't painful, but it wasn't comfortable. And I was told to go back in the waiting room and sit down. And then she called me back again, to reposition me, get a better angle. And I was told to go sit down, and she called me back again. And I remember, because, I try to make jokes out of everything. It's like my coping mechanism. So I remember telling her, I was like, girl, you ain't gonna get nothing for Christmas. If you call me back here one more time to stick my little tiny little tatas in this machine, you gonna, piss me off. So anywho, I did that the third time, sat back down, and I got routed to get the imaging, ultrasound. And, same appointment, appointment as the mammogram. And so in that ultrasound, it's the first time I ever knew that there was a position, professional position of a radiologist oncologist. She walked in the room while the technician was doing the ultrasound and, kind of shared with me that they were concerned and that I would have to go get a biopsy later. So, my stomach dropped because again, here I am going through this life change and I'm like, really like cancer? But in my mind, I'm still thinking scientifically at this point. I'm not, in my patient mode yet. But, we know that cancer is just nothing but an overproduction of cells that go awry, right? Like our body, I think on a daily basis creates 1 billion new cells. So every now and again, one of them go funky. I kind of tell folks that like having, cancer is like having that baby kid in the classroom. Like, that one kid that just kind of won't follow directions or instruction is just all over the place. And so, when the oncologist came in and told me she was concerned, I was like, okay, that's fine. I'll go for this biopsy because that's going to be the definitive diagnostic piece, right? They stick the needle in, they pull a tissue sample, put it under the microscope and diagnose it. So I scheduled that appointment for the next week because again, I just wanted to not have to go through this during the actual like Christmas time off and all that stuff. And so I got that needle biopsy, and probably not even 24 hours later, I got a phone call. And so as I was going through all this, they do give you options at the clinics and at the hospitals about how you want to be contacted, if it is bad news or if it's good news. And so I did opt for the phone call versus being, called back in for another follow-up appointment. And I remember the phone call came at about a little bit before 6 p.m. And, I was coming home from work, the kids were coming home from school, and, I answered the call, and I got the terms, you have cancer. And again, my stomach dropped again. So I remember just walking into my bedroom because I think I was trying to make dinner because I was still cooking back then for my kids. But I knew I needed a moment because I wasn't sure how I was going to react. I was kind of prepared for it, but I wasn't really prepared for it because those are some hard words, to kind of swallow and even hear. And I remember saying to the doctor on the phone, I was like, well, do you think I'm going to die? And he was like, no, don't think so. I was like, okay, well, at least I'll, maybe get some new boobs. That's how I handled that diagnosis. But again, 34, right? And no family history. I was working out. Thought I was healthy, thought I was doing the right thing. And I still had this diagnosis. So Dr. Maya, before I keep going, I don't know if you want to interrupt me with questions.
I do have questions, but I definitely want to give you, I know it's your story and your journey, and just want to, thank you for sharing it and respect that. Just starting from what the first thing you said, having a career. And at that time, how old were your children?
I want to say 13 and then 2 8-year-olds.
Okay. 13 and 2 8-year-olds. So you have twins, going through a separation and also a career, yes, but you were a manager, a leader, a boss in it, and trying to maintain that as a Black woman in a white male dominated space. You mentioned, you said, I'm sorry for kind of how I presented when I was dealing with all of this. Just getting into, it reminds me like how Black women in general, but especially Black women, feel like we have to present a certain way no matter what's going on with us. Of course, you were stressed out and things like that. But also, my question to you is, in that moment, when we look back and when people look back at the experience of Black women professionals, things like anxiety, PTSD, without the space to actually talk about that stuff, it presents as an attitude or wrestling, yes. But when other cultures do it, it's, kind of pour them anxiety, things like that. In your space right then, did you experience any of that at the organization or the corporation you were with? Because you were in a corporate pharmaceutical industry. Did you experience any kind of need to present a certain way or push back when you needed to take time out for your healthcare and any kind of limitations to you basically taking care of yourself?
Yeah, that's a good question, because I feel like my 34-year-old self at that time, I was eager to prove something. And I had learned at an early age, and this is unfortunate, but that we have to be over-prepared and overqualified to do our work, right? Or to even be recognized in our space. And I was, like, to your point, I was climbing up that ladder. I was seeking, that elevation in my career. So I didn't let, even at the time of the diagnosis at that biopsy, I didn't share what was going on with my immediate supervisor or, even my HR department, because I was still trying to process it myself, but I didn't want my personal baggage to spill over. And I think that's something, as Black women, we've just been conditioned to do, right? I don't think folks realize, like, when you show up at work at 9 o'clock, whether it's in the office or virtually, the different traumas and microaggressions that hit us before we even get to work as compared to our counterparts. And so again, I thought I was doing well, trying to have this facade of showing up to work, not even 100%, but like 120%, but with all this going on. And again, with the divorce and the separation, I felt alone, right? Like I had to call my mama, right? Like here I am, without this formal support structure. Yes, mama's always there, but mama can't be everywhere, especially when you got the kids pulled in. And after separating, I was in this bad chick mode, right? Like I don't need this. I'm gonna go out here and be great. And so I was making good money, but I moved into a house that I could probably barely afford, right? But again, my ego, I wanted to feel like, the loss of a marriage, which, because it is a loss, it would have no void in my space. I was going to elevate instead of, having a gap. So all that with this cancer diagnosis, but really, to your point, the employer piece didn't show up until it was time to actually take off of work. So I had decided to choose February as my month that I would do the chemo, and I elected to do a double mastectomy. And so at initial diagnosis, my cancer was diagnosed as ductal carcinoma in situ. So if we think about the breast, the lobules is where the milk is produced. The ductals is what takes the milk, to the nipple, to the areola to feed the baby. And so my cancer was in one of those ductals. And sometimes people can have like cancer in the surrounding tissue, but mine was in a ductal area. And then in situ means that it was kind of in place. So it had not crossed, over to any surrounding tissue or what have you. And that's something that cancer likes to do. Like, sometimes, well, most times benign tumors, they stay put, but cancer likes to grow, and boom, start to, knock on your neighbor's door. And, that bad kid that's just, ruining the whole block. So at the initial diagnosis, it was considered to be contained. So I elected for a double mastectomy. And this is where it gets funny, because it was really, truly the influence of celebrity news. Because at the time, I think Angelina Jolie found out that she was at a high risk for cancer, and she decided to get a double mastectomy, I think a hysterectomy or what have you. And pardon me if I'm, misquoting what she actually went through. But because that narrative I had seen on, TV shows, when it came time for me to choose my particular treatment or regimen, I went that route. Because again, mind you, like going through a divorce, I got these saggy breasts, right? That they're all little kids and sucked on and they lost their life. So if I get this double mastectomy, I'm going to get implants, and still go through the cancer piece as well too. But I got these nice new boobs. So that was me kind of rationalizing it and, kind of being able to move forward without too much fear. So I elected to have all that done in February. What I did not expect is for my employer at the time to change our benefit structure. So at the time, I think I was employed with that company for 13, 14 years. And historically, every change of the calendar year, so starting January of whatever year, you would get blessed with all your sick days, vacation days, and boom, boom, boom. Well, that year, going into 2014, they decided to do an accrual system. So mind you, I had tapped out all my 2013 days for the workup, the diagnosis, all these different appointments. And mind you, all the days I take off for the kids being sick and all that other stuff, right? So I started 2014 with actually a deficit. And so February is only 2 months in. So I'm like, oh, darn, this isn't going to be enough days for me to do, sick days, short-term disability, boom, boom, boom. Because again, here I am living in this, expensive house, and my kids were still in private school. How am I going to manage all this? And so I remember going to my HR office and begging. And I don't beg, right? I got an ego. I don't beg. I didn't beg my husband. I didn't beg nobody, right? I begged HR. I was like, look, can I be grandfathered into the prior structure? Because I got all this going on. And I was really transparent. I showed them my bills, how some of my bills were behind. And, they made me get vulnerable just to kind of like petition or put in this request. And I was told no. And so, of course, I was like extra pissed because here I am disclosing all this information. And again, this is, for a company where I'm trying to move up the ladder, but I'm showing y'all how raggedy my stuff is, right? So I can get these benefits continued. And I was told no. And so I just kind of pushed it to the back burner and went through the double mastectomy, where, they removed all of my breast tissue because the cancer was determined to be close to the nipple. And there was another spot that was within the breast tissue as well, too. So the left breast had to remove all the tissue, including the nipple on the left breast. The right breast, there wasn't any cancer there, but again, younger age, likelihood that the cancer would reappear and potentially move over to the right breast. So that's why I got the double mastectomy. But interesting point, I had to fight to save my nipple on the right side, because I understood why y'all had to take my nipple for the left because the cancer's there, but ain't nothing wrong with this, right? So can I keep my nipple? And I actually had to barter with the, surgeons and physicians to keep the nipple. But anywho, so all the tissue was removed. And after the mastectomy, they give you these expanders, these kind of like balloons. But in addition to like some tubing that kind of collect the lymphatic tissue, all this drainage from the trauma of the surgery. And then eventually you get the implants in and stuff. And I remember when I went home with the expanders and with the tubes, I was so squeamish. Like I didn't want to change the bulbs that collected my lymphatic fluid. And I think you had to like change them 4 times a day. And I couldn't get myself to do it because it was like, blood, pus, and again, that lymphatic drainage. And I remember, my mom would come over and do it. And one time I had nobody to call. So my 8-year-old son had to do it, right? Like I'm showing him my deformed tatas, and he's draining them. So again, vulnerability. And when I look back again at this experience, I sometimes regret that I, put my kids in a situation where they had to like kind of take care of me. Hopefully that'll make them, productive adults as they enter our society because they kind of have seen me at my most vulnerable state. But yeah, and so in the midst of that, when I should have been convalescing to get back to work, to get healthy or what have you, that money wasn't coming in the way it was supposed to. And then, I didn't have child support coming in. So stuff started getting even more raggedier. But yeah, that was probably the biggest impact that I had from an employer perspective during that journey.
And then, thank you for sharing that. The impact, again, you mentioned anxiety, PTSD from that. And even as you're talking, there's an apology for how you think it may have impacted others,
Mm-hmm.
As you, and we'll get into, and so it sounds like you were doing your regular regularly examining your breast in the shower or where that was, because you were able to talk about monthly and, how the textures changed over time. You got the primary care, but with someone else. And something that I really want to talk about, but maybe towards the end, that leads to a lot of Black women getting late diagnosis. It was because you had good insurance,
Mm-hmm.
And that's something we can impact when we talk about social determinants of health and access to care. So then you get your exam and it goes to an ultrasound. So you get the mammogram, which is a smash in the x-ray. Then you go to the ultrasound. And then you go to the third one. When they see it on an ultrasound, you go to a biopsy where they take out the actual whatever they saw on the mammogram that led to the ultrasound. The ultrasound is it has more dimension to it. The mammogram is a flat x-ray. They're just looking at a flat film. Then they get a 3D, like move around, let's see where the angle is, and the ultrasound allows them to do that so they can pinpoint it, so they can go in and boop, just get that area and pull it out. A biopsy is when they send it to a cell specialist. They, make it little thin sheets, put it on a microscope, and they look at it. They says, oh, that looks like DCIS, right?
Mm-hmm. Mm-hmm.
Or ductal carcinoma in situ. Okay, now we're here. Then they say, oh, we're going to take it out. They see where it is, take it out. And then you get, and so when they took it out, did you get the breast augmentation at the same time? So they cut out the original one and put the augmentations in at the same time?
No, not immediately. And
Okay.
I also forgot to mention too, at the mastectomy point, as they were scraping tissue, there was evidence of cancer outside of where the imaging had shown. So it kind of tweaked my diagnosis, to be a little bit more invasive. But also too, I had a, what do they call it? Lymphodectomy. Like I should know these scientific terms, but they removed some lymph nodes to test those because, cancer tends to go to that lymphatic route. And there wasn't any evidence of tissue, the cancer cells in the lymph nodes, but they did, pull some out while they were doing a mastectomy. But to your point, these expanders that they put in, they are kind of like balloons, I say. And they have a flat plastic back, and then they have like a, I don't know, vinyl or whatever front. And I would have to go in every 2 weeks to have these expanders filled up with air, because there was concern whenever most women get mastectomies done, they want to make sure that the skin tissue is healthy and that there's a low risk of necrosis. And so instead of inserting the implants immediately, these expanders over probably, a month and a half or 2 months time, I would go in and they would slowly put more air in them to fill out the capacity. Again, to just kind of make sure the skin was viable enough to be able to survive another, traumatic surgery with the insertion of the breast plants. So that was probably like a 2-month gap of me having those expanders. And again, every 2 weeks, just going in, more air goes in. And, my chest was like rebuilding itself essentially. And then, I went for the actual implant surgery after the 2-month period.
Okay. Now, during this time, and you're talking about this experience, was there a place for stop, or did anyone offer you a connection to a mental health expert during this time? Did any like healthcare professional say, hey, people go through this and, it might be good to connect with a mental health or integrative health specialist?
No, I had a nurse navigator who helped me. And even some of that help was like, here, take this 300-page manual, go read it. Here are some resources on, page 26 if you need them. But no, I never really had that mental health outreach. I did get some referrals like acupuncture, and then like, doing laser therapy to prevent so much hair from coming out during my chemo. But mental health, no, it was never addressed. I don't even think in my appointments was I given the, what is it, the PHQ-9 scale, where you just ask those basic questions.
Yeah, the patient health questionnaire, where we, there's essentially 9 questions that we ask about how you're feeling over the past 2 weeks, because we want to know kind of if this situation is impacting you in a negative, positive, or any kind of other way. We want to check your mental state. So we ask these 9 questions, and at the end we ask, hey, if if you indicated that any of these questions were positive, like you felt depressed, or you lost interest in doing things, or you have problems focusing, how has this impacted? Has it stopped your ability to work? Or are you sometimes thinking it'll be better off if you're not here? We ask those questions, which are very important. Especially, I mean, even you said it yourself. We've heard anxiety, PTSD, all these other things, having to be vulnerable, feelings about your kids seeing you in this space, all at the same time, right? While you're climbing this corporate ladder, which sounds pretty raggedy, but in your work later on, I'm gonna jump ahead and we'll jump back. Later on in your work, you have supported women dealing with breast cancer. Do you see the need for increased mental health connection and support through this process, with the patients or the people that you help support?
Yeah, I think it needs to be first and foremost. And I think, it's a shared responsibility. So often we hear the narrative that, Black folks don't want to do therapy. But it really too, there's responsibility that lies with the care, not even caregivers, the clinicians who treat these patients, whether it's the specialty folks, so the oncologists, or whether it's that primary care physician, to make sure that's first and foremost in the assessment. I think we're so conditioned to look at labs and look at, some of that clinical data that we forget the whole piece of the patient, that whole patient who's in front of us. And I think about my own experience with really identifying that I had depression. It hit me in a weird way. So, when I felt confident that I was going to live and do well, but then there was this background angst of, ooh, maybe I'm going to die, right? And so I was like, maybe I've been married once. My ex-husband and I, we started dating real young. Like that was my only experience, right? So I remember going crazy on dating apps, right? Like I can't die with just one relationship. I'm doing air quotes relationship. I gotta diversify my stocks, right? So I had some atypical behavior where I had a what do they call it, an insecure, like a hotation. To be truthful with you, I just was doing my thing, and I really had to stop and look at that behavior and like, that is atypical. That is not you, Ramona. And that's when I knew that I was having some undealt with depression and stuff. And I wind up going to a therapist, and she wasn't a good fit because her response was, well, you need to let go of some of your responsibilities. She didn't look like me, and obviously she didn't have the same lived experience as me, so she didn't work. And I think I waited probably about another 4 months to find someone else who did have this outward appearance as me. And even she couldn't understand because she wasn't sitting in the corporate space that I was. And, I had to date some therapists, and it took me, about 4 bad dates to find a 5th person who was a good fit, a better fit. But again, I think this is something that we need to infuse into conversations more than what we deal with, because, patients are more than just the clinical part and the imaging part and all that good stuff.
Yeah, because really holistic health does start here. So we can talk to someone all day if they not, if we don't get and support them to a space where they can advocate and move for themselves when they're out of the clinician exam room, then we won't kind of get anywhere. And I just want to say thank you for mentioning that women and people, just like your doctor, if the first one doesn't work, that's not indication to just stop and just throw the thing away. You have to move on and find someone that really, really fits you in a supportive way. So thank you for saying that. Now, you also mentioned something. You said, hey, your first one kind of didn't have the same live experience of a Black and brown woman in corporate as you. When it comes to breast cancer, we know that African-American women have a 41% higher rate of breast cancer being terminal. And then if the person is under 50, that actually doubles, which is weird because, the U.S. Preventive Task Force guideline, you start screening at 50. How old were you?
34.
Right. It says start screening at 50. And then between 40 and 49, you kind of individualize it, and you were 34.
Mm-hmm.
And then noting there's no clear evidence of any need for any screening below 40 or above 75. Now, where in that, when we talk about guidelines, is not written for you, you know what I'm saying? I just think two things. I'm thankful that, and we encourage regular breast exam, so you know your body, so you can advocate for yourself. The other thing I want to get to, we talked about the mental health and the importance of it now, and we talked about your experience with corporate, but we haven't even gotten to other things and to what that might look like on the other end of how the corporate relationship, where did that go and where you are now. But now we're back to kind of your experience and your story. We're at the point where you have your breast augmentation, mm-hmm. and things like that. Tell me now, do you get one breast augmentation and bit back done, that's it? Or for your healthcare, how is that handled? So, and then you also mentioned that when you got the mastectomy, there was evidence that the cancer had moved. Can you touch base on kind of those two things?
Yeah, so in surgery, I guess there was evidence of cancer being in other spaces in the breast, and again, what had appeared on imaging. So they did, at the point of the mastectomy, scrape out all the tissue and even some surrounding tissue just to make sure that that was kind of taken care of, and that too was one of the reasons why the nipple was removed. But to your point, so after the expanders, when it was time for the implantation of the breast implants, I decided to get these ones that are called gummy bears. That's not their brand name, but they're supposed to be like more lifelike and feel better than the saline, because these are silicone based. And so again, 34, I'm thinking about, my life trajectory. Again, I would have these kind of like ups and downs, days where I felt like I'm going to live and I'm going to conquer the world. And then some days where I'm like, ooh, I'm going to die, right? Like that was just the honesty of my space. But knowing that I wanted to have a relationship and there may be a potential for another marriage or what have you, I opted for the silicone, the fancier ones, because I didn't want, I wanted to feel as natural as possible. But what they don't tell you is that when you get these mastectomies and they clear out all that tissue, your nerve endings are gone, right? So even to this point, because the implants, depending on which ones you get, you still have to get like the regular mammograms, because again, cancer cells, they lay in the smallest little pockets and they may pop up anywhere. So just because I had all the breast tissue removed doesn't mean I'm absolved from getting any mammograms. But what was my point? So they don't tell you that you lose your nerve endings. And so the sensation, it feels like, when you go to the dentist and you have that Novocaine, even to this day. So I get no pleasure from anybody, touching my breasts anymore. It's kind of crazy. And I know we had talked about this before, you and I together, but I was concerned about body image as well too, because I'll tell you, and I'll tell the audience, to this day, I still take showers in the dark because I can't look at myself naked. Now, isn't that horrible? Like, we're talking about, some surgery that I had back in 2014, it's now 2022. But because I feel like, in my mind, that would probably be my breaking point if I saw, the scars and all that stuff on my body. Now, when I was, in this hotation phase and, when I calmed down, no one, from that partner perspective had any concerns about the breasts. They were fine with them. Even the one that was reconstructed with the nipple, I had gotten the areola tattooed. So, it looks kind of weird because you can see the scars, but, never had any complaints about it. But for myself, I still can't look at myself naked. And so here I am being vulnerable to the rolling out audience, but that's my thing. So what was your question, Maya? Because now I'm lost.
Why you say, you never said that, Ramona. One
Yeah.
second. Sorry.
Yeah.
Okay.
Yeah.
Okay.
Yeah. So
that just reminds me, like, so now, you've gone to this place, and it reminds me of Black and brown bodies of women throughout history, how things get done to us. Now you've gotten your like x-ray, come back, let me smash them more, get to the left, get to the right, and now they're cutting them, and now you have to barter with the certain, like, so much stuff you said about your body, and now, you're talking about your sexual stuff, and your partner's like, well, it don't make me know, it don't matter to me, get over here, and how there's so many layers of this when you think about what's in a lot of African, not all over Africa, but clitoral removal, because sexual pleasure is just for other people and not for a person, a woman herself. And how a lot of times in our community is so normalized, like, you're like, yeah, I make jokes about it, because that's the way I deal with it, that's a lie. That's a lie. Oh, how do you even have the conversation with your partners about kind of that experience or augmentation or mastectomy?
So typically, I share with them the breast cancer journey, and I, let them know about the surgery and the implants, but I never give a forewarning, like, hey, when you lift up this shirt, you're gonna see all these scars and this little tattoo. Because it's amazing. Like, I think I'm in a good space, right? Like, I advocate for other women. I work with, non-for-profits and different advocacy groups, and I, tell women to, fight for themselves and be the voice for their, own experience. And again, I still can't look at myself naked, right? So, and I do share this whenever I have a platform with women. I share that piece as well as the financial toxicity, because I don't think we talk about that enough. Because even with me making good money at that time, I didn't have that nest egg. I had probably depleted some of it to shift from out of the divorce or out of the marriage. But like, I still got residual BS. I'm still looking for a husband number 2 to come clean my credit, right? Because it was like this domino effect of just bad decisions, whatever you want to call it, bad. I didn't plan for it, right? I'm 34. I didn't plan for it. I didn't have that emergency fund. I had a nest egg, but I didn't have that emergency fund. So that's kind of the honest pieces that I like to share with women when I, meet with them. But it's definitely about, I try to still empower and try to, let people give grace, right? Even when I talk about the hotation, even when I talk about, Kettle One being my best friend, right? Those were some of my coping mechanisms. And I could, blame myself and say, oh, that's poor behavior. But it was the honesty and the reality of the space that I was at the time. And I'm comfortable and I forgive myself for that.
Wow.
Because, I have to be able to keep moving forward. And even when I found out that the cancer had returned, that created a whole new set of just, but we are complicated people. And I think our vulnerability, I hope, will let us be stronger and powerful. Because we don't have to always walk around in shame. Stuff happens, life happens, but we are resilient women, and I hope that's what folks can kind of take away from this dialogue. I'm not talking here to be a woe is me, but I'm just showing my honesty and showing the fact that I'm still here and I'm still somewhat successful by definition. My family is beautiful. My kids are doing great. And yeah, but I still got this crap.
So tell me about, you mentioned finding out that your cancer has returned, and some people ask, like, what's remission? What is that? And are you in remission, or like kind of what definition of different stages and stuff like that? Tell me what it was like to find out cancer had returned.
Yeah. So after going through the mastectomy and the chemo associated with it, I was taking a pill, tamoxifen, which is like a anti-estrogen pill to reduce my risk because my cancer was determined to be hormone receptor positive, HER2 negative, probably some other letters I'm missing. So the tamoxifen was going to lower my risk of recurrence. And so it was also too suggested that because I have this hormone receptor cancer, so like my cancer feeds off of my estrogen, it was recommended that I get a hysterectomy. And at the time I was still 34. And again, y'all, like I was like, oh, okay, I may get married again. I may meet the second husband who's gonna fix my credit. He may want to have kids. I may, I got to keep my options open, right? I said no to that recommendation. And again, I already felt like Frankenstein. And mind you, I had already had surgeries. I had 2 cesarean sections. I had a oophorectomy, so removal of a ovary when I was like 17. So I wasn't new to surgery and I wasn't new to being Frankenstein, but I just couldn't do the hysterectomy thing. I felt like I didn't want to get rid of all my options of living a somewhat normal life after cancer. And so I think that decision to say no maybe shifted the level of care that I received with the oncologists, but they were so focused on that gynecological piece. But it took an accident with my youngest daughter, who at the time was probably 9. I don't know, we were in bed, she was flipping around, doing cartwheels, dancing, something, but she dropped down and she elbowed me and she chipped my front tooth. And so, again, because I'm always one to make jokes, I'm like, how am I gonna get y'all a new daddy? Their daddy's in their life, so disclaimer, he's present. But I'm like, how am I gonna get y'all a new daddy if I ain't got no front teeth, right? So I remember going in to see the dentist because that tooth was gone. And I assumed he was fitting me for an implant. And he had this fancy machine where he was kind of scanning my jaw structure to see, where the implant would go and look at the health of the surrounding teeth, blah, blah, blah. And he saw something in his jaw, and him knowing my history, he said, Ramona, I want you to go back to your oncologist. And it was that freaky random incident where I found out that the cancer had metastasized. And so metastasized means that, you have a recurrence, but it's moved from its original location. So it was no longer in my breast, but it's still considered breast cancer, but now metastasized breast cancer because it had navigated to my bone in my jaw and my hip at the time. So that was how I found out about that, right? So again, we talked about earlier, Dr. Maya, the social determinants of health. I had good insurance, making 6 figures. Shoot, I'm a clinician, right? But I feel like some of the missteps along the way was unfortunately because of how I presented, that I wasn't listened to or valued because of how I present. And I think the more that we can kind of come to grips with some of those barriers that are in healthcare journeys, like women who look like us or, others, the better that we can do at, tackling some of the inequity stuff that we see. So yeah, that was that.
Wow. And so where are you with that? So you found out there's in your jaw and it's in your hip, unfortunately, and then it disappeared, or it's still there, or what, did they form a plan for that?
Yeah, so it's still present. The tumors they did shrink in size. So that was like 2016 when that occurred. And, I was told to do some more rounds of chemo and radiation. And I think I went through maybe 2 rounds of chemo and I was just tired. And, what really reared its ugly head, Dr. Maya, was that fear of going broke again. So I was like, F this, I can't do chemo. Like, again, I'm trying to climb this corporate ladder. I got these kids, they're getting older. I got worried about colleges. And I had taken them out of private school, put them in public school. So I did have some cost savings here. But when the chemo piece, knowing I would need time off of work for some of the, horrible side effects, fatigue and everything that comes with chemo, and being a pharmacist, I got to be able to boom, 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 and after those type of appointments, I would not be in that space. So I opted to halt my chemotherapy. Not the best decision. But again, it was Ramona, the patient, really, taking precedent over Ramona, the clinician. And again, I got some pushback for that. And the pushback, it could have been a bargaining chip. Like, the relationships that we have as patients with our providers is so key. Like, we really have to treat it like it's a marriage. I know I mentioned that about the therapist, but that's true of any clinician that we have. So whether it's a MD who's treating you, or a nurse practitioner, or a PA, have that bi-directional trust and open conversation with them, because it's only together that you guys, make decisions on whatever your healthcare journey is or your health condition is. But they have to be willing to listen to you and hear you, and vice versa. So yeah, I opted to stop, and I could have been offered a holiday, a drug holiday, where I take a break and they reintroduce, hey, Ramona, are you ready? That never happened. But what did happen was I was looking on a computer late at night because I couldn't sleep, probably because there were some bills unpaid, and I found a clinical trial. And I reached out to the sites that were involved in the clinical trial, and it was for metastatic breast cancer, early cancer women, hormone receptor positive, HER2 negative, and I found a site that would take me, and that's how I got introduced in that space to some new novel medications to treat my cancer. But again, that's because I knew that was an opportunity, that there was a place where I could go look for information. And it wasn't because I was driven there by my clinician. So have been part of, clinical trials for quite a while since that first one. But more recently, I just got diagnosed with heart failure, which is unfortunately some of the side effects from the chemotherapy, actually, because they can be what we call cardiotoxic. So with this diagnosis of heart failure, I had to step down or be removed from the most recent clinical trial that I was in. So right now I have to reevaluate, what my treatment's going to look like. But hopefully that gives the audience the answer to that question.
Well, thank you for sharing. And then for those cardiotoxic, you're speaking of the chemotherapy drugs that you receive. Cardiotoxic meaning they have a negative effect on the way your heart functions. So you take the chemo drug, and so your heart is impacted by that. It's one of the side effects. Mm-hmm. That's a lot. That's a lot. Which, when I go back to what you said at the beginning of this conversation, and I know we've gone through a lot, you were like, hey, when you're in your workplace and you're just presenting, trying to do your best just to make it through. I also know I've seen you do a lot of work with different organizations in Chicago that support women experiencing breast cancer. And hearing this, now now people know the background. Anybody listening now knows the background as to why. Can you talk about the healing kind of that you offer the community through doing that work? And I've also heard you talk about the women support group for people experiencing breast cancer. But Ramona, you've also done a lot of work with the African American community as far as joining them to research and the importance of African American communities and people being involved in research. Can you talk about how kind of where you are in your life with that, and how that not only impacts you, but helps to impact community?
Yeah. So Dr. Maya, I know the work where we first were introduced in the HIV space, in that space, we were always the advocate for our patients, right? We always somehow navigated to that patient who had been written off because they were either like an IV drug user, or they didn't, keep up their medical appointments in the past, just, been written off. And we created success for those patients, but that was by, again, looking at them as a whole patient and not just lab values. So whether that was looking at the case manager to make sure that that patient had housing, or, transportation to and from appointments, like all that stuff was important in order to get those lab values and that clinical piece under control. And so understanding that, but then becoming a patient and seeing firsthand some of the barriers, and even seeing barriers, even when I'm not a drug addict, I got a good job, I got transportation, but sometimes that $20 parking back and forth to these appointments, it ain't that stuff add up. But it gave me a deeper understanding of what the needs are when it comes to what do patients need, what do their caregivers need, and what do we as clinicians need to do better? Because again, it's a shared responsibility. And so that's some of the honest dialogue that I put into these advocacy groups that I partner with. So Sisters Working It Out in Chicago, they are excellent when it comes to, supporting the needs of women of color who are going through breast cancer, because I've heard so much that those women feel left out when they see some of these larger campaigns and some of the commercials that are very like, for lack of better words, homogenous in their imagery. So whether it's that commercial, that brochure, it's typically, a population that they don't identify with. And because we know in Black and Brown communities, we get breast cancer younger, that too adds another element of lack of representation, right? So Sisters Working It Out, Sisters Network, which is a national organization, they do phenomenal things for women. And again, looking at the woman and her entire needs. So if there's need for childcare, if there's need for, paying some of those utilities, because I'll tell y'all, I remember, calling my doctor at that first go around with cancer because my lights were about to get cut off, right? And like, again, on paper, I make good money. So they're like, well, what's going on with you? You mismanaging your money? And I'm like, no, that stuff got tapped out because it was spent, my living expenses were more than 30% of my income and blah, 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 blah. And that was my reality. So making sure that women are connected to, all those other like wraparound services that needs that they have outside of just the clinical piece, but in addition to the clinical piece. We do have the large organizations like Komen, Avon has their, programs. So it's really working in collaboration with those different advocacy groups because they all kind of have their specialties of what they're good at, but collectively, when they partner together, that's when they're more impactful. So I've definitely take some of my lessons learned from the HIV space and pull them over into the breast cancer space to help women, who look like me so that they don't have to have that same experience that I had and that I'm having, when it comes to breast cancer.
Ramona, I do really thank you for, when I said, open up, I didn't know we were going here. So I thank you for allowing me to be part of your journey. I thank you for everything you do to be part of everyone else's journey. And we definitely thank you for the healing you're bringing to yourself and bringing to community. Any last words you have for anyone listening out there?
Mm-hmm. So I just want to thank the audience for listening. And again, I want this to be more empowering than, just hearing somebody else's story. But I think we could all kind of resonate with elements of my story. I know we talked about the research piece. There's a lot of research out there. Research is not just, drug trials and all that, but it's important for us to be reflected in those spaces because, as Dr. Maya and I mentioned earlier, guidelines are based off of scientific evidence, and scientific evidence includes research. And so if we're not present or counted in those spaces, then we're often forgotten about. When we talk about the BRCA gene, there's an underrepresentation of samples from women from diverse groups to get us, more understanding as what are the implications with this hereditary piece of breast cancer, not only from, prior family history, but your future family history. And we know that BRCA gene, it has implications for ovarian cancer, but with research, we're now seeing that there's a kind of a dotted line to prostate cancer. So again, typically we think as women like, oh, if I got this gene, my daughters, their daughters, and even men too, right? Because I think people forget that men have breast cancer, Richard Roundtree, Beyonce's dad, what have you. But now this correlation with prostate cancer. So we have to be present. And, even if you're introduced, research by your physician, you don't always have to say yes, but I think it takes that honest dialogue. And that's why that trust between you and your doctor is important for you to decide whether that's the next best, a best step for you to be part of research. And then in the cancer space, research is not an option of last resort, right? I want people to get rid of the fact that, cancer is a death sentence. No, cancer is a disease, just like other diseases that, we deal with. But, as research is increasing in that space, there are newer precision medicines, precision therapies, even laser therapy so that women don't lose their hair. There's all this stuff going on, but it's important for us to be included so that when these guidelines are drafted, it's known that this is going to work for us, right? It's known that there's going to be less harm because we were included in that research. And I guess that's what I will end with, really just to empower women and this broader audience that's listening, just be a part of your healthcare journey. You drive your healthcare journey, but your partner is that clinician who treats you as well too.
Wow, Dr. Burress, you are definitely amazing. Even in this, I'm like, anything else? And you just start spitting out all this stuff for the community. I gotta tell you, I'm continually, I just stay constantly amazed by your work, your legacy, and what you do. And thank you for being a warrior for the community, and thank you for allowing me to be part of community service with you and standing beside you, behind you, in service to the community. Thank you so much, Dr. Burress, for joining us today.
Thank you, Dr. Maya. Look, I owe you more. You've definitely held me up and been that shoulder I need to cry on many times. So I am blessed to be in your presence professionally and, personally. So thank you.
And the community is blessed to be in yours. I'm Dr. Maya Green, signing off for Her Health. Stay strong, community, and thanks for joining.